A new report is out from the Department of Correction. What NBC Connecticut investigates is learning about the conditions inside Connecticut prisons tonight. Thanks for joining us tonight for the news at 6. I'm Mike Heideck.
And I'm Keisha Grant. We begin with people waiting years for critical health care. That's the bottom line of a report on the Department of Correction shared with NBC Connecticut Investigates.
The Connecticut Office of Correction Ombudsman, which advocates for better prison conditions, gave Besthoff an exclusive interview to discuss the findings.
The report said just in the last few months, more than 2,000 inmates had been approved for referrals for medically necessary outpatient care. Things like cardiologist visits, cancer treatments, and imaging. And they've gone months or longer without even being scheduled. The Ombudsman's report concluded the DOC system to set up these appointments is backlogged and lacks accountability, at one point with more than 2,400 inmate-patient referrals.
I was shocked when I saw the list.
The report highlighted 6 cases, one where a man died. He was hospitalized for a heart problem in January. By the time he died in March, his cardiology appointment had still not been scheduled. In another case, a cancer patient said he wasn't consistently taken to chemotherapy. The report says the man is not on a list to be taken. A third inmate not only waited 2 months to be seen for a torn ACL in his knee, but he was still waiting to be scheduled for physical therapy and surgery 8 months later.
The latest list, which we have, that was pulled on March the 13th, there are 58 people that have been waiting on that list since 2024.
The report concludes if the DOC does not improve, it could be legally on the hook for what's known as deliberate indifference to inmate care. Ombudsman Devon Ward is calling for immediate corrective action, issuing subpoenas for DOC leaders to testify at a public hearing. What happens if nothing happens?
My office doesn't have the authority to make DOC do anything, but I certainly think that holding the hearings, having public insight and transparency into what exactly DOC is doing to address this issue will serve as a catalyst for action.
In a statement in part, the Connecticut DOC said it made more than 10,000 outpatient specialty appointments last year, noting it did this despite a growing shortage of physicians, and it will continue to strive to have those who need specialized care receive it as soon as possible. Besthoff, NBC Connecticut Investigates.